Okay, let's take a look at the blood vessels that we have in our body. The main thing here to understand is the main blood vessel that comes out of the heart is the aorta. The aorta goes up, makes an arch, and then it goes down, as you can see down here. Okay, the one that goes up, ascending aorta. This arch, aortic arch, as you can see it right here. And then the one that goes down, descending aorta. The descending aorta is going to have two pieces, the one in the abdomen, abdominal aorta, and the one in the thorax, thoracic aorta. Branches of the ascending aorta are going to be the coronary arteries, and the coronary arteries provide blood to your heart. Branches of the aortic arch, you've seen here three. 1, 2, and 3. This one is a brachiocephalic trunk. This one right here is the left common carotid, and this one's left subclavian. This is left subclavian, left common carotid. So where are the right ones? Well, if you look at the brachiocephalic trunk, you can see that the right ones are these ones. This is the right common carotid, and this is the right subclavian. The blood vessels are going to provide blood to the different organs and structures that we have in our body. So the common carotid is going to provide blood to your head. So every single time you hear common carotid, for example, left common carotid, you're going to have two branches. One is going to be internal and the other one is going to be external. So then, as you can see here, you have one here, which is the external carotid, and another one right here is the internal carotid. The internal carotid usually goes inside through your skull into the different structures that we have inside our skull, such as our brain, for example. And the external carotid will go into our face. So you can see these branches in here, superficial temporal artery, facial artery, etc. So with that, we cover the area that belongs to the neck and head with this big blood vessel right here, which is the common carotid, the left, this right common carotid. The descending is going to provide you with a lot of branches for different structures that we have in here. For example, it's going to give you branches for the lungs, such as the bronchial arteries. If you keep scrolling down, you can see here the descending aorta, the level of the abdomen. And here we say we have a lot of organs. And the name of the blood vessels are going to be easy because the name of the blood vessels will match very closely the name of the organ. So, for example, the blood vessel for the liver is a common hepatic artery. The one for the spleen, a splenic artery. The one for the kidneys, renal artery. For the stomach, gastric artery. For the intestines, it's just a little bit different. It's actually called mesenteric, as you can see here. And there are actually two, superior mesenteric and inferior mesenteric. One thing to mention is that the blood vessel that provides blood to the ovaries and the testicles are going to be branches of the abdominal aorta, as you can see here. You see, the blood vessel starts in here, it goes all the way down here to where the testicles are. So this is a very long blood vessel that goes from the top. And the same happens with the ovaries in the case of females, right? It will go down here. Okay, so you have the descending aorta at the level of the abdomen. And then since we have two legs, this descending aorta is going to branch out into two common iliacs. This is going to be the left common iliac, and this one is going to be the right common iliac. And as I told you, if it's common, it's going to give you two branches. This is going to be the external iliac that will go towards your legs, and this is going to be the internal iliac that will go towards the pelvic area. For structures that we have in here, such as, for example, the uterus, in the case of females, the prostate, the urinary bladder, etc., etc. Okay? Okay, so we have covered blood vessels in the pelvic area, in the abdomen, in the thorax, in the neck and head. Let's take a look at the blood vessels at the level of our arms. So for that, we have the subclavian artery that goes down like this, and it's going to give you a very important branch, which is going to be called the axillary. The axillary will go down into your arm, where you're going to get the brachial artery. That's what we usually use in order to get the blood pressure. From there, it goes down. It's going to give you two very important blood vessels, which are going to be the radial artery as well as the ulnar artery. They continue down, and they're going to make an anastomosis, which is connection between blood vessels. right, which are going to form the palmar arches. Those are the main blood vessels that you need to know for the arms. Let's go down to the legs so we can see the branches. And right here, we have, we already mentioned the internal iliac, so we need to talk about the external iliac. The external iliac is going to give you this very important blood vessel, which is the femoral artery. There's another one right here called the femoral artery. The femoral artery goes down, it's going to give you the popliteal artery. The popliteal artery is in the posterior part of your leg. It's not in the front. It's not on top of your kneecap. Then it goes down. You're going to have anterior tibial artery. If you have an anterior tibial artery, it's because you also have a posterior tibial artery. And after that, you have the fibular artery. Okay, those are the main blood vessels in there. At the end, at the very bottom, you're going to have the dorsal pedial artery, which is this one right here. Okay. Okay, and those are the main arteries. Let's take a look at the main veins. The veins are going to have the same name as the artery. So, for example, if you have a renal artery, you have a renal vein. If you have a femoral artery, you have a femoral vein. So, as long as you know the names of the arteries, you will know the names of most of the veins. So, the only thing that you need to know or you need to learn are these veins that we don't have as arteries. So, for example, if you look at this drawing, you have this very long vein right here, which is called the saphenous vein. This vein right here, very important, it's very long. So we don't have that as an artery, so you need to remember that the saphenous vein is in the legs. So if we scroll up, you can see here, for example, that in the case of the arms, we have a basilic vein, a cephalic vein, which are not present as arteries most of the time. Same thing applies to the neck. In the neck, we have common carotid arteries, but they are not common carotid veins. They are actually called jugular veins. Okay, very important for us to remember that. And also, we know that we have a superior and inferior vena cava, and we don't have that as arteries as well. Okay, those are the main blood vessels that you need to know for your exam.